Hello, can everyone hear me? Hi, hello. I'll just give it a few minutes and then we'll go over everything. Hello? Can anyone hear me? Hello? 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 Can anyone hear me? Just type anything in the chat so I know if you're able to hear me or not. Um, just type something in the chat and let me know so we can get started here. shoot. Hello. I'll just give it a minute here and see if anybody is available. Um, is there anyone listening? I just want to see if anybody is able to hear me, just so I'm not just talking without, just want to see if anybody's available. Can anyone hear me now? Just enter some thing in the chat box on the right, and then I'll know if you're able to hear me or not. Maybe there's a problem. I don't know. Uh, Anyways, I'll get started here. Um, how does this work? Okay. So, hi, my name is Snail Desai, and I'm a pharmacist as well as founder of PharmBitz and PharmInsurance. Some of you may have already seen my videos on this channel, and I truly hope they are helpful to you as you prepare for your NAPLEX boards or continue with your pharmacy journey. In today's presentation, I'd just like to highlight a few important points about the pharmacy courses and resources that many of you may have already come across through the PharmInsurance or PharmBitz. So let's just get started, and thank you for joining in today's session. In this course, my goal is to provide you with a clear, simplified, and structured review of all major concepts um, covered on the NAPLEX exam. I've been looking online, and I've seen that many of the people are um, are having tough time in passing this exam. So I've created this video to help kind of introduce you to this NAPLEX course that I've just started. So it will help you um, alongside while you're studying with your materials as you prepare for the exam. Just some things that I'll mainly go through are things like pharmacology, some calculations, some mainly all the disease states that's covered, and also so much more. I can also share some, uh, you know, uh, things here about compounding because and pharmacy law and patient safety because there have been some interesting um, way there in the past. At least the main things were calculation, compounding, and biostatistics. Those were like the ideally the main things that was covered in the past. But with the new blueprint and all that has just recently come out, sometime around May this year, there have been some additional things that have been added. So I've created a few presentations in this channel on covering some of those areas like ethics and some of those pharmacy regulation laws and things like that. So, and patient safety. So everything you'll need to know is going to be on this channel so that you feel confident before the test day. Each video in this series will focus on one major concept at a time. So we're going to be breaking down very complex concepts into easy to understand sections with examples and practice style questions. I also recommend that you definitely review the shorts, because there is a lot of informational content that is in there too, and questions. So definitely go over that. The questions may or may not be as difficult or challenged as NAPLEX exam wise, but at least those little concepts, you may still see a few of those questions as you take the exam. Now, I know there's a lot of case-based questions, so definitely review those case-based, type of questions as well. I will also have a few case-based questions within these videos as well for you to review on side. So we'll be looking at all of that. So, like I said, I'm a pharmacist. I'm licensed in 2 states, Florida and Texas, and as well as I have had some practice experience in the pharmacy for past 5, 6 years. So I'm just going to share a little bit interesting things here. So one thing is that you're going to have a lot of new resources posted every week. So I'm going to at least post maybe 4 or 5, maybe 2 or 3 sets of questions you can just use to study while you're studying for the NAPLEX, okay? So review those questions. I'm trying to make it easy for all of you. So you'll see a lot of questions posted within the playlist area on the YouTube channel, and those playlists are divided into different categories. So those different disease states, you can review those types of topic questions, or you can review the comprehensive mixed questions as well for your review. I'm going to post as many questions until you can beat this exam. So don't make yourself feel overwhelmed unnecessary, because I'm going to help you all out as much as I can so you guys feel very confident for this exam. So feel free and ask any question you'd like. You can listen in the chat, you can comment on the channel, and we can just work together and get through this for you all. So that's that. So really want to make the pharmacy learning accessible and straightforward. So whether you're preparing for the NAPLEX, or any type of board exam, even pharmacology exam for other healthcare students, it's going to be all accessible on this channel. You guys can share it with any other healthcare professionals. It's not going to be much different. You study here a disease state on thyroid, you study a disease state on like diabetes. Every healthcare professional is going to use some sort of information that's going to overlap, so everyone can use it. You can share it with your interns, you can share it with other pharmacists, you can utilize it in practice. Sometimes I have to utilize it when I'm helping a patient, help them understand while counseling them. Some of the information that's already in these videos are going to be very useful. You might have a technician, or you might have a patient coming to the counter wants to ask you a question, and you might need to look it up to see what it is. So I'm just letting you know that it's not just for the exam, it's also for useful for practice as well. So you guys can all use it wherever you like, whenever you like. The videos are there. So it's not just for people who are studying for NAPLEX, it's also for people finishing pharmacy school, want to refresh your knowledge. Some of the medications that are on these shorts are showing illustrated so that you guys can see where exactly things are working, why they're working, why does a side effect occur this way, or why which way is this drug going? Is it going through the GI tract? Is it going through the liver? Is it going through kidney? There's things that you have to just visually see it to understand it. So I highly encourage you to at least take a look at those shorts. You don't have to fully understand, but you can at least picture some things. Maybe it might be going through bloodstream. Maybe it might, well, most of the drugs will go through bloodstream. But anyways, it might come back into the blood from the kidneys. You might see some of those videos there on that. So these are very relevant information. Some of the drug interactions are very useful. When you're studying for the NAPLEX exam, you're going to notice a lot of the drug interactions too, very common ones too. I think there was one that was posted on the interactions between like the statin medication and like a blood thinner, or it's some unknown medication interactions. Now you may not see a DUR show up on the screen on your system with an interaction like that, but or you may see it, but you might wonder, if you see an interaction like that, why does that interaction occur? So those kinds of things might be important. One medication might be helping or preventing another medication to break down the body. So all this, it gets a little bit complicated, but at least those little complex details might at least help you kind of see why the medication is causing certain things to occur. Why is cholesterol so? Why is the statin medication causing so much muscle pain? So what other medication on the list might be causing it? So those kind of interactions are very helpful for that. So I highly recommend you definitely take notes. And whenever you review these presentation videos, definitely pause the video when needed. And, definitely use the review materials provided in the description to strengthen your understanding of each topic. So I'm doing everything I can to help you all pass this NAPLEX exam to, so that you guys don't have to struggle so much on it. I've also listed a lot of easy to, short, easy mnemonics that might help with understanding certain things. So when you go to exam, at least you don't have to, try to remember certain drugs like HIV medications or, those kinds of things. So it's very, very, very important that you guys just keep studying it. In my experience when I was studying it, I definitely went back and reinforced concepts from the previous chapter every day. So if I study the first chapter and the second chapter, at least going back to those the next day and reviewing what those chapters are asking about, what is the meaning behind it, and those kinds of things. And then just going through the whole thing. Definitely every day, just reviewing the previous sections and chapters. Don't just read it, but also understand, like, there's a few things you want to know. You want to know why the disease is occurring. What is this disease about? And how is the medication going to help treat it? At least look at it this way, what medications are also used for treating that disease? And then what side effects am I going to anticipate getting if I was to take that medication? imagine yourself as a patient and you were going to take this medication. So what you guys need to do is definitely review these concepts. And that's all about disease states. Now, in calculation portion, you're going to have to definitely memorize those formulas. You're going to have to know how to, calculate um, every pharmacy, uh, scenario or situation that occurs. You need to know how to calculate those things. So, like, I think there was a customer who just came to a pharmacy who had a concentration and a volume, and need to figure out how much is needed for this volume. So you guys need to know that the C1 V1 equals C2 V2 equation. So you guys know how much volume is needed for that concentration or that amount. So those kinds of things. And counseling, definitely, sometimes you're going to have customers or patients during your practice where they're going to ask you question. I believe there was a time when I had one where asking about how to use an inhaler. So you want to definitely know all those kinds of things as well. The using of the inhalers, how to use the insulin devices, different types of insulin. I don't know if the NAPLEX will ask you about, which, patient not having a prescription with them, they wanted to buy an over the counter insulin, which one to get. They may ask you, but if they do, you should definitely know that. Some of you might already know in practice about 70-30 insulins, Humulins, and Novolin, and those kinds of things. So definitely look at that stuff. Over-the-counter medicines are very important. Most of the time, patients gonna come and they want to get some Sudafed products, or they want to get some over-the-counter eye drops. So definitely knowing all those kinds of things as well. Also, like cough and cold, medications and uh, burns and wounds and those kinds of things. Very important. So knowing about those, the sunburns, SPF, all of that is very relevant and is a fair game on the NAPLEX exam. In terms of compounding, definitely knowing the USP 797, 795, 800, all three of those standards is very, very important. So definitely you want to also know all the excipients used, because there have been times when people have said that there were some of those types of questions on there too. So definitely important. Garbing as well. So they may ask you the order in which the garbing should be done. Obviously, you want to start, from the dirtiest to the cleanest, or those kinds of things. So definitely review all that too. So get all your calculations down. I have posted a few videos in this course so far, a few on dilutions and some of the equations that's used in understanding that, as well as, I believe you might have seen one on, if I can remember, dosage and proportions, percent strength. All of those are on the channel as well, for you guys to also use to review while you're studying for the NAPLEX. There are a few practice questions, and I've listed the practice questions there with the answers, but if you need more explanation as to why those answers are why those are the answers, or how to get to those answers, I'd be free to help you with those areas as well, because that's actually most important, is how you get to that answer. Um, I know that some of you might have a little bit trouble there, so I can help you all with that as well. Um, I do definitely recommend you review some of these charts as well in the videos, because they are also going to be very useful for you. Um, when you see these things, when you see these videos, when you review these shorts, when you review your book, these shorts and these videos are you're going to be your best friend while you're studying your books, because a lot of the illustrations, you're going to start thinking about them as you go for the exam, and you might want to see it, so it will make it a lot easier for you all. So recommend that you utilize this. um, and you're going to see a lot of repeating concepts too here, because um, some concepts aren't listed. So there might be some overlapping content, which is actually fine, because now you may have already seen some of the content previously, but you're going to see some content again. So at least I will make sure that you can retain a lot of this information for the exam. So you might see a lot of repeating things. Um, it's for your benefit. So I'm doing whatever I can to help you all out. Um, so a lot of the examples here, a lot of the interactions, a lot of the mechanisms you see here, some of these are actually from practice. So you're going to see a lot of things where people have asked you a question. I think there was one about an antidepressant drug, whether it can cause an appetite, uh, used as like appetite stimulant, or suppressor, or what it does. So there is a video on that. You guys might want to review that, and check it out. Um, Knowing all the different types of alpha, beta blockers, um, knowing that, how a beta blocker is going to help with like heart, or how it's going to help with, um, you know, with blood pressure, So knowing that, and there's also a lot of other new things, out there. So GLP-1s, for example, you need to know differences between the Zepbound and the Monjaros, and because, that's a very, very highly used or dispensed medication too in many pharmacies. So review those types of things as well. Weight loss, diabetes, um, and knowing the mechanisms, how they work, and things like that. um, Definitely knowing the pharmacogenomics, which ones are going to break down in the body versus which ones are going to remain, um, and leading to those toxicities. So those kinds of things. I think the main thing is really you're going to see a lot of case-based questions. That's going to be mostly you know areas where you're going to find like the interaction or side effect, or whether it's going to help the patient or not. But when you do go through this test, um, you don't want to look at the whole case first. Go down all the way to the question and read the question first. Okay? Read the question first. Do not read the whole case. You'll be wasting a lot of time there. There might be some unnecessary detail that you need to know to answer a question. So read the question first. Um, that's really going to be the best way to get through this really quickly. Um, And, just do not stress out, relax. So kind of also ask your colleagues the questions too. You can go in and, you might not be, uh, while at work or somewhere, you can even ask anyone. You can ask your parents, you can ask your brother, you can ask your family, you can ask your sister. You can ask anyone a question on any pharmacy knowledge. It will help you, and it will help at least uh, you'll be able to know more that way just by talking to them about it. And then they might ask you a follow-up question on it. So it's actually going to help that way. So with that, I do hope that you find these videos helpful. So if you do, I highly recommend you subscribe, like, and share them with other pharmacy students, interns, healthcare providers, anyone who may benefit from these reviews. Um, your support definitely helps me continue creating more educational content for our pharmacy community, healthcare community. Um, we're just, healthcare is, something that everyone needs. We need to help all our patients. So you need to take it into account of how am I going to, if you have to think of each question as like a patient. A patient coming up, they ask you this type of question, what's going to be your answer? Which one of these choices is going to help them? If a patient comes in and wants to know whether this medication can be taken with food or not, do you know if it can or not? You have to know those kinds of things. Patients might come up and ask you, what to take if they have an allergy to certain medications. So, also understanding what is actually a true allergy versus what is not a true allergy. And that's a very another important point, before taking the NAPLEX exam, knowing the allergy is also important. Um, on the exam, I think there's two things you want to look out for. First, you want to read the question, but then you also want to see in the case if this patient has any drug allergy. Because if they have like a penicillin allergy, which is very common allergy, um, you want to, that's something that can actually eliminate some of the options on the test. Um, you might have some options, listing someone a penicillin, one that doesn't have a penicillin. So the one that doesn't have penicillin should be the answer to your question. So allergies, definitely look at those allergies. Um, and I think that's pretty much it. So does anyone have any questions? And, I'll be posting more videos and reviews for you guys too as well, so you guys can use it as a way to study for the NAPLEX exam. Um, so I hope this video helps, and if you have any questions, feel free to let me know. Um, I'd be happy to help you. Thank you for watching, and I hope you all have a good day. I do want to mention one other thing. We do offer a one-to-one personalized tutoring. So if any of you want, more assistance with someone, you know, we do offer it, but, um, you would just have to, it's very simple. You would just go on the YouTube website, the Farm Insurance YouTube page, and then you would just book your appointment on there, and then we will just review. We will just, just go over the concepts that way. Um, so, does anyone have any questions? I know I kind of covered a few of the things here just to help with, uh, getting us started here with things. Um, I know it's, I know it's a tough exam, and uh, that's why I feel like I want to help you all, and you know, I don't know if any other way to do it unless you guys have any suggestions or want any more advice. I know a lot of my videos don't have any audio, but if you guys feel like I should add a bit of audio, I can definitely do that. But again, I put it out there so you guys can at least read it through. It's pretty much self-explained, but we want to make sure that you guys also get the best experience out of them as well. So um, that's pretty much it. I'll just give you guys a few minutes. If you have any questions, feel free to list it or comment or whatever you guys need to do. And that should be pretty much it. Does anyone have any other questions? Is there any concepts you want to go over, like right now, or anything? Do you have any questions about any materials? If there are any additional notes you'd like, or any additional information, about this course or the sessions that we offer, or any of it, well, I'm happy to help you here. Um, but that's pretty much it then. Hopefully, you guys find um, these videos, these presentations, and all the shorts helpful. And a lot of questions I'm going to put on out there is going to be related to a lot of the videos posted in the channel itself, so you guys can be more comfortable answering those questions that's in the videos. Um, Use them as a test. The calculation questions I posted, um, there's two different sets here. You have one without the answers and the one with answers. I would review the ones without the answers first and go through those slides and try to answer as many as you can, and try to do it very quickly, because I know it's a very timed exam. It's a timed exam, and it's, you know, very uh, hard to get through it sometimes. So definitely want to review that. Um, so if you have any questions, feel free to let me know. Um, that's pretty much it.